One of the things like when joining like IFTF, like one of our distinguished fellows who's been around like doing futures work for like 40 years, like Bob Johansson, he likes kind of challenging people to come up with titles like, what kind of futurist are you? So because I'm still new at IFTF, I'm toying around with like, well, what kind of futurist am I? I'm new to this kind of work. So I've been kind of looking at this idea of, like in my head, I'm thinking of this like well-being design. One, because I'm trying to move past this paradigm of health care, because I know as someone who studied public health and just been in this industry that it's not health care, it's like, it's health, but it's kind of more than that. Because to me, you know, maybe still not definitionally, but I think in terms of connotation, we still think of health as addressing illness, addressing this sort of gap or deficit and sickness, and you know, even the language of like disparities. And so when I, at least for me, when I think of well-being and what that conjures, it's like, what is the sort of affirmative side of that? Like what's our sort of optimal state of being when you think of the sort of various factors that affect that? So that's the sort of well-being part of it. And then like the design piece of for me is like, how do you do that intentionally? Like, and also how do you test that like along the way, and like you use that sort of like paradigm of like thinking and prototyping as way of like, you know, moving yourself to well-being, but also realizing that that's going to shift as time goes along, or as, you know, other factors come into play. And so that's kind of, I think, like where my like strengths and skill set like are, like that, you know, what is the positive side of like what health and well-being can offer, and then also where's the sort of experimentation science-y side of things that I think I also bring to the table, that kind of analytics like meets like impact.